Okay, hello everyone, and welcome to another episode with Stop Counting of the Community Health and Capital podcast with 19 Hills Community Interest Company. I'm very excited to say I'm joined here by Lizzie, Makeda and Mohammed, who all have been or currently are medical students at Cardiff University, and they've joined us from the Refugee Health Project. Hi, guys.
Hello.
Yeah, thanks.
We're going to talk a bit about a few things today. We're going to talk about the project you guys have set up and are leading. We're going to talk about how that could be integrated into places like the 19 Hills Health and Wellbeing Centre or other health centres around the country. I think you guys have got a lot of wisdom, a lot of expertise to share in terms of issues affecting certain population groups and access to healthcare in general, both in Wales and the UK. And it's the first time we've had any students on the podcast. So very excited to have you here today. And I think there's some obvious and interesting conversation we can have there. So Makeda, why don't you start by telling us about the project?
Yeah, so thank you for having us again. I'll sort of start off by how it all started, and then I'll tell you a bit about what Safe Surgeries actually is. But essentially, in my sort of final year of uni, where I'd sort of had a background in working with refugees and asylum seekers through a student charity, and had done an intercalation in like population medicine and learned about health inequalities. That's sort of where I realized what I wanted to sort of set up this project to try and address the health inequalities from a student level. And that's where we set up the Cardiff Refugee Health Project. And we do loads of sort of advocacy work, whether that's working with like local charities in Cardiff and running health education sessions, research. But one of the main sort of things that we try and focus on is expanding safe surgeries in Wales, because there was really a sort of gap where no one was actually advocating for the expansion of safe surgeries. So that comes onto the topic of what actually is safe surgeries. And it's an amazing initiative set up by Doctors of the World, who just essentially want to make healthcare more accessible for patients that find it difficult to access primary care. Um, so that encompasses refugees and asylum seekers, but also people that don't have a fixed abode, sex workers and undocumented migrants. All of these people have unfortunately experienced discrimination, whether that's been through the registration process or interactions with clinicians. And they essentially, and we also want to just create a safe space for these patients, because that's what healthcare is all about. So essentially what it is just a simple checklist that GP practices need to follow, like a gold standard essentially of guidelines to make that surgery more accessible. So that's things like ensuring translation services are available. It's not insisting on asking for proof of ID or for proof of address, and definitely not for proof of immigration status, because obviously that is something that can greatly sort of deter someone from then accessing healthcare. They might think that that information might then be shared at the Home Office. So those are sort of the main points that a safe surgeries actually is. And
And Makeda, there's probably lots of issues, but why do you feel this project is needed in places like general practice in the UK in 2024?
yeah, I think when it comes to like accessing primary care, like that's something that should be for everyone. And I think it's, studies show that unfortunately it still is an issue. I think a recent report by Doctors of the World show that there are still about a third of patients that still aren't able to register if they don't have proof of ID, proof of address or immigration status. So there's a sort of a mismatch essentially between what NHS policy is and what actually is put into practice. So that's really why we need that. We still need to sort of advocate and push for safe surgeries until everyone ideally is putting the fair policies into practice.
Body are not working there. And the project you said is in Wales, but Doctors of the World obviously is an international charity. They've presumably been running this in the UK. What have you seen have been some of the kind of successes? How well has it been taken up, do you think, across the UK so far?
Yeah, so I guess with in England it's a lot more well established. There's a lot more GP practices, but unfortunately in Wales the uptake hasn't been as high. So that's essentially what we're trying to do. But I guess more recently I was on a sort of primary care attachment during my F2 placements, and they were already a safe surgery, and they have quite a high asylum seeker population because I was based in Luton. And just to see sort of, like I say, a newly sort of arrived asylum seeker come in, and obviously they had a limited language barriers. So straight away the GP partner knew to how to access and use the translation services. He explained to the asylum seeker of their entitlements, which was access to free prescriptions, and showed them where the pharmacy was. So it's small steps, but honestly, going above and beyond and creating that safe space really makes a difference in, affecting people's health seeking behaviors. So if we can do that and if we can implement that, we shouldn't underestimate how big of a change that can make in health, addressing health inequalities.
You said obviously, Makeda, the project has benefits or application to lots of different groups of people. Obviously, your group is called the Refugee Health Project, but I'm pretty sure there's research that suggests that, flexible appointment systems and kind of flexible, systems in general might benefit lots of people who have challenges in accessing services, be it because they have kind of certain health needs, certain disabilities, perhaps really, don't have a kind of a fixed home and such like, really. How much do you think this is maybe a direction of travel we need to go in general, and what might some of the barriers be in terms of services running in that more flexible way?
Yeah, I agree with what you say, definitely. And I think safe surgeries isn't just limited to refugees and asylum seekers, but all patients that might have difficulties accessing primary care. So it's something that can be sort of widely applied across many patient groups, because they've expressed to us that they do experience discrimination and they prefer having to access specialist services, but they shouldn't have to. Everywhere should be a safe space for them to access healthcare. Um, and sorry, your second question
It's
was
just, taking into account, I guess, the pressures in the NHS in general, but also primary care. I imagine there could be some resistance to this, depending how wide you apply it.
yeah, no, I think definitely it does require a bit more time, especially with like translated appointments and things like that. But I think that's where you sort of have to have that empathy and sort of realize that if you were in that situation, you would want that same experience for yourself or for your family members. And I think in some areas where local authorities do sort of appreciate that there is those extra pressures, they might get more funding for patients that say have limited like language capability, limit language barriers, or just need longer appointments for whatever reason. So there are some financial incentives there to sort of support practices because it does take up more resources.
Thanks, Mikita. Well, I want to come back to towards the end in terms of kind of what the next steps could be if practices or services wanted to kind of get involved in this and what it might involve. But I wonder if I can bring you in, Mohammed. So obviously we're talking about the kind of medical aspect just now, and healthcare is only one part of, a number of possibly challenges that some of these population groups kind of face. Tell us in your experience what kind of the policy environment is at the moment, really, for some of these groups across the UK.
Yeah, so obviously there's a difference between asylum seekers and refugees and undocumented migrants. So if you, I'll just to categorize them initially. So asylum seekers essentially are people that have left their country of origin and are awaiting the result of their asylum application, whilst refugees are people that have been granted the right to remain in the UK. So for these individuals that are waiting for this, they are entitled to getting free primary care as well as prescriptions, just like any other Welsh citizen. Um, there's a lot of people that are typically waiting for asylum, and NHS Wales guidance insists that patients don't, well, asylum seekers and refugees, or any patient, to be honest with you, don't need to. There's no requirement on them to prove either identification or address. So whilst this is why essentially why we're trying to push safe surgeries, because not only are we trying to advocate more and more of an equitable service for everyone in the community, but also we're trying to adhere to NHS policy. And a lot of GPs practices may not know this, and maybe a lot of the people that work there, such as receptionists, may not understand this. So it's essentially we're trying to educate about the NHS Wales policy, and essentially, and it's a universal right to having healthcare, and it's protected under international humanitarian law. So yeah, that's essentially what we're trying to push. In terms of NHS Wales guidance, it is still updating. So especially when it comes to undocumented migrants, it's a little bit of a grey area. But we are working with Public Health Wales to try and get a solution and a bit more clearer guidance on this issue. But when it comes to asylum seekers and refugees, there should be no reason why any of them should be rejected based on lack of proof of ID or proof of address. If that makes sense.
It does make sense, Mohammed. Yeah, I mean, we're veering from medicine into other spaces and to politics, I guess, really. But there's obviously been a change of colour of government at UK level. 100 days, apparently it's been already. Does your project or colleagues get any indication that things are changing in terms of and a more supportive, kind of compassionate atmosphere in the UK towards asylum seekers, refugees, and migrants in general?
Yeah, I think it has definitely improved. So obviously, when we had the previous Conservative government, they were advocating for the Rwanda project, which was to sort of deport a lot of asylum seekers and migrants to Rwanda, which obviously just didn't make any sense. They spent a lot of money on I think it was at 600 million or a few million anyway on that project, which didn't even address the underlying situation. A lot of these people have to take unsafe routes to get to the UK, because the only way to claim asylum in the UK is if you're on UK soil. For a lot of other countries, such as for instance, if you take Ukraine, UK worked very hard to create safe routes for those citizens, and as well as other citizens as well. If asylum seekers from I think Afghanistan, Hong Kong, and Syria, they have these settlement schemes which provide them with safe routes. But for a lot of other countries that may be fleeing war and persecution, they have to take these unsafe routes and to get onto UK soil to claim asylum. And unfortunately, a lot of people have died in this process. So even if the media tries to sort of propagate this, we have a problem with migrants and refugees, and the washing up on shores, as quote unquote. Fortunately for these people, this is the only way they can get in. And obviously the climate has changed a little bit, so they scrapped the Rwanda project. However, I don't want to take too much time into into the hostile environment, because I think Lizzie might be speaking about that later, but there is still very much a hostile environment within the UK, especially towards refugees, and it stems back to previous Tory governments that we had. So I like to keep optimistic, so hopefully the landscape will change and hopefully improve, but we'll just have to wait and see. But it's going in a step in the right direction, I guess.
Thank you, Mohammed. I mean, I think it's worth remembering and acknowledging that Wales is a place of safety. I think it wanted to credit itself as a nation that is welcoming, compassionate, humane, etc. I think there are examples probably we could all think of that we can show where that has been more the case, really. But I think there's still a clear challenge. And I suppose what I was going to do is just kind of moving on, because clearly what changes this really isn't always kind of guidance and education. advocacy and a bit of cage rattling sometimes is what is needed. And I think it's brilliant to see you guys are kind of thinking practically what services can do, really, but really being those advocates that you often see uh, youth organizations are in general, if I'm still allowed to say that, Makeda, after you graduated. But Lizzie, I mean, we've talked before, and I'm only going to very briefly touch on the fact that you and I have kind of crossed paths in life, with me being involved in Students for Global Health many, many moons ago. I know you've just stepped down from being the
Yeah, so I was
before.
I was helping direct last year, and I wasn't ready to quite leave just in my final year. So I'm still on committee, but yeah, not leading it this year.
I don't blame you. So just, I suppose in your experience, Lizzie, but I'm sure there'll be others that might want to come in on this too. What do you feel these experiences give you in terms of, where students can make a difference, students can, advocate for change? How do you feel that sits alongside the kind of traditional structures that we have in medical training and in medicine and healthcare as a whole? What do you feel you've learned, and how could you take this forward locally, nationally, internationally? Tell us about what you think.
Yeah, definitely. I think there's I've sort of always said this. I think in working in these spaces, I get like far more out of it than I probably would get in other spaces. So it's definitely like a two-way process, and that we really enjoy being able to give our time, and we get so much back. I think like just on a personal level, I really value the sense of community that we've built. Um so it's like this is, I guess, example today, like working with Makeda and Mohammed, like it's so nice to come into spaces with people who share your same passions, and trying to channel that into like something positive. And I think maybe just to come back to what you were saying earlier, sort of have we noticed a change with the politics and that kind of thing? I guess we can think about the bigger scale. So yes, there's been a change in the government and that kind of thing. But when you think about it on the ground as well, we've come into contact with so many people who do care about refugee rights, whether it's in the health space or beyond. And I think it's so reassuring to remember that actually there are so many people who care. And I find that really inspiring and really motivating as well. So definitely that's one thing. I think as a student as well, it gives us a chance to sort of um, maybe work in areas that we wouldn't normally. So we've got a bit more insight into maybe leadership or how practices are set up, for example. And just working patient advocacy, which at the end of the day is what being a doctor or being a health professional is all about. It's making the best for our patient. And I guess just being here today is sort of testament to that as well. We get so many opportunities from this. Like, I don't think anyone would really want to listen to me on a podcast about colorectal cancer or breast cancer or something, but actually this is something that we can talk about, and we don't need all that experience, but we've got the passion, and we've got experience between us as well as a group that we've really built up over, well, I guess it's only 3 years that we've been going, but we've done quite a few projects in that time. So it does give us a chance to sort of contribute in ways where maybe in traditional medicine we might not be able to do as much.
Thank you, Lizzie. I guess this question goes to all three of you, and people feel free to put your hand up if you want to come back on it. So one of the things that our community interests company is very passionate about, and I think we're starting to see that being picked up a little bit in the planning for a few centres across the UK, is involving residents, involving local communities in the management of the centre. Back a few episodes ago, we spoke to Professor Jenny Poppe from Lancaster University, and the clear message is that we're quite behind the times when it comes to engagement in NHS, really, and engaging with people. We might be better at it with some services than others. We might be better at it with some groups of the population than others, really. But we tend to be more engaging than actually inviting people to be at the management table. And I think that is obviously challenging, to be honest, really, because a lot of professionals and managers would feel quite uncomfortable, perhaps, really having conversations around where do you put resources, how do you run services, how do you validate them, etc., with people that it affects. But that doesn't mean that it isn't something we should do. How do you feel we do in terms of giving students the chance to engage in these sort of discussions at an undergraduate level? Do you feel you've been encouraged to get involved in university, the medical school? Do you think we could do more with students in terms of kind of giving their voice of view in terms of kind of services locally too?
I think, well, I can start an answer and obviously guys chip in, but I think from our experience, we've had really positive reception to the work that we have done. So I guess sometimes we've gone out and sought those opportunities, and it would be nice maybe if there was some support in finding those. But I think it's been really reassuring to see the responses that we have got. So maybe just as an example, but when we first met you, Johnny, which was at the Deep End Wales conference, we were asked to come and speak about safe surgeries. And I remember me and Makeda driving down and thinking, you know, who are we to talk to a room full of qualified GPs about how they should run it? But actually, we were really surprised at the reception that we got, where everybody said, you know, actually it's really nice to see that students are leading this and that you care, and that's really inspiring for me. So I think sometimes it's quite easy to forget that actually we all do have something to contribute, and maybe we all personally look at maybe the things that will go wrong, but actually remember that yeah, we've all got different sort of skills. And so as you're saying, like bringing communities into the leadership of our organizations is so true, especially when we're talking about safe surgeries. It's about addressing a lot of holistic needs. So is very little about the actual medicine, but much more about supported with the admin side or getting language support, for example. And that's where it's really helpful to hear from people who've got experience in those other areas. And we work really closely with quite a few different third sector organisations. There's a fantastic centre for refugees based in Splot in Cardiff. We work there running sort of health awareness sessions. And the volunteers there are so people can use or how to navigate certain protocols or fill in certain forms. So it's just, I think, yeah, really helpful to remember that actually everybody can contribute. And I think that's a big take that I've got. Yes, as a student, I really can contribute. And it's really nice to see when people are receptive to that. And I think, yeah, just open to learning.
Brilliant. Okay. Well, Makeda, lead us through, if anybody listening to this either worked in or managed or ran some kind of primary care facility in Wales or the UK, how could they get in touch, and what would the next steps be in terms of how they could get involved?
Okay. So I guess when it comes, if they are interested in becoming a safe surgery, that's already a step in the right direction. In terms of how it goes on from here, I guess if we can put a link maybe in the episode, just to direct people to register, and it's just a quick form that sends you straight to Doctors of the World, and you just have to put in your GP practice details, and then from there Doctors of the World sort of just guide you through it. Essentially, they send you resources, they organize training sessions, they help you sort of amend your policy to make it more of a sort of accessible policy, and essentially making sure that it is in line with being a safe surgery. And any sort of queries that you've got, you can reach out to them. But alternatively, you can also reach out to us. You can find us on social media at the Cardiff Refugee Health Project and on Twitter as well. And if you've got any other questions, you can also reach out to us. But ultimately, to register with them, it is through Doctors of the World.
Brilliant. Well, thank you, Makeda. Thank you, Mohammed, and thank you, Lizzie. It's been a great introduction, walk around the Safe Surgeries initiative, the Refugee Health Project. Hopefully one of many podcasts where they have yourselves or other students on too. Thank you for your time, and thank you everybody for listening to the Community Health and Capital podcast, affiliated with the 19 Hills Community Interest Company. If you've got ideas for another episode, you want to feature on it, or get any ideas, feel free to get in contact at info@19hills.org, and we look forward to coming back to you with another episode very time soon. Thank you, everybody.
Thank you.
Thank you for having us.